Hello, my name is Dr. Pietro Memmo. I'm an interventional physiatrist here at Orthopedic Associates of Hartford. I've been here since 2002. Today, I would like to discuss the type of patients that I see, the type of conditions that I treat, and the types of interventions that I can perform in order to help relieve your pain. Some of my background is a little different than many other physicians. When I was in college, I was actually at St. Charles Borromeo Seminary in Philadelphia, Pennsylvania. There, I studied philosophy, and I was actually spending 4 years studying to be a Catholic priest. I decided that that was not the career that I wanted to choose, and I eventually went to New York City and I worked in banking for a few years trying to contemplate what I actually wanted to do in my 40s and 50s. I eventually decided to go to medical school. First, I had to complete all my pre-medical studies, and I did that at Columbia University. And thereafter, I went to medical school at Albert Einstein College of Medicine in the Bronx. While at Albert Einstein College of Medicine, I really loved neurology, I loved orthopedics, and I always loved using my hands. And I thought about different specialties such as neurology or orthopedics, and I figured the specialty that really brings all of this together and really helps patients regain their functionality was being an interventional physiatrist. While in my residency, I decided that I was really passionate about pain medicine as well as sports medicine. And I decided to do an extra year of training, and that was a fellowship year that I did at Beth Israel Medical Center in New York City. While there, I was also able to become board certified in pain management in addition to physical medicine and rehabilitation. So today, the combination of being not just a physiatrist but also a pain management specialist, I'm able to diagnose patients with a variety of conditions. And if you recall, my background has focused not just on simple sports medicine injuries but also patients that have true neurological deficits, whether it's a stroke or patients that have a traumatic brain injury. So I have a real good depth of experience as far as neurological conditions. With my pain management skills, I'm able to offer a lot of treatments for patients that have painful conditions, particularly in the spine. So the primary focus of my practice is spine care. That makes up 90% of my practice. So I focus mainly on spinal conditions that affect your neck, your mid-back, and your low back. Conditions such as a pinched nerve. That can perhaps be one of the most debilitating conditions patients can have. So I treat patients who have sciatica, and that can either be from a disc herniation or it can be from spinal stenosis. Other conditions I treat include mechanical back pain or mechanical neck pain, and that can come from arthritic conditions. For all these conditions, there are interventions that I can provide to help people live more functionally with less pain and hopefully actually give them a really good quality of life. Probably as high as 99% of patients can be treated non-operatively. Most conditions of the spine are conditions that are as simple as a strain and sprain injury to aggravating some underlying arthritis in your back that all of us develop, to conditions such as a disc herniation that most times does not require surgery. Other times patients may have neck pain from a whiplash injury. Again, that's something that can be treated non-operatively. Patients that require surgical intervention are patients who have exhausted conservative care. That care can include medications, physical therapy, and time. Those patients that don't get better from simple medications or customized therapy, we have injections that can be done. Most of these injections are very specific, tailored to what the patient actually has. So our objective is to really diagnose what the patient has and then customize what is the most appropriate treatment. The number one way not to see me is number one, exercise. Work on your core muscle groups, do planks, do sit-ups, and work on your flexibility. That can probably keep many patients out from seeing me and getting hurt to begin with. When you get hurt, we'll gladly see you and treat you and even educate you on how to avoid future surgery or future interventions.